Scope of psychiatry nursing. Psychiatry nursing, otherwise called the mental health nursing. The people who are studying mental health nursing or psychiatric nursing, what all the scope, where and all they can work. First, they have a big opportunity to work in the mental health hospital. Here in this video, I'm also telling just roles also, some few roles where they are working. So it will be easy, even question is coming as a scope of psychiatry nursing, you can attend, or else the role of psychiatry nurse in various setups also you could be able to answer the question. Mental illness hospital or mental health hospital, inpatient department, outpatient department, OPD, ECT room, counselor, she can work as a nurse educator, and emergency department also, treat the acute patient also she can work. Industrial medical center, she can work as a counselor, work life balance, employee education, and ergonomics. What is ergonomics? Fixing the right people for the right job, that's called ergonomics. And the group psychotherapy, mostly they will conduct resonance therapy, yoga, guided imagery, many things to release their stress of the employees to prevent the stress related mental illness, and provide CBT. What is CBT? Cognitive behavioral therapy. And then de-addiction center. You know, de-addiction center, not only by alcohol and drug abuse, nowadays de-addiction center, their mobile addiction center, pornograph addiction center, many people are, many different cases and different age group of the people you can see. You will be surprised to seeing the age of the people also. So you have a most opportunity to work as a counselor, individual. You can work as a counselor, and individual therapy or interpersonal therapy you can conduct, psychotherapy, CBT, yoga, and you can administer medication. Inpatient, sometimes you can take a patient and counsel. So whatever the counsel, whatever you are giving, wherever you work, the 6 C's you have to remember. What is that 6C? Care, compassion, courage, communication, commitment, and competence. Sometimes I have seen the psychiatric patient suddenly will come and beat you or slap you. You are not supposed to beat them again, because you should have some empathy towards them. Always non-judgmental and empathetic behavior, you always the psychiatry nurse must possess. Then hospice care center. What is hospice? Hospice is the place where the person is living like with the chronic illnesses, mostly cancer, and they are about to die within 6 months of period. Those kind of people only they are there. How much they are traumatically, they were damaged mind, they are very much depression they will have. So you should give them the emotional support. So you can involve them, what is the diagnostic emotional problem or what is the mood disorder, you can use the diagnostic part, and treatment, emotional and behavioral disorder you can find out, and you can counsel the patients and counsel the family therapy, family counseling, you can give acceptance, and then perform the high risk assessment. Anyone will go for the suicide or something, you have to prevent them. So the hospice care will be different with the chronic illness patient, different kind of empathetic care you have to give as a psychiatric nurse. Then will be the schools and colleges. So schools and colleges also you will give the basic health services and counseling, the behavioral, some of the children's behavior will be deviated behavior will be there, so you have to find out. And then you have to, substance abuse will be there, those children you have to counsel them, prevent the mobile addiction, you have to educate the parents regarding the, treat the behavioral problem as I told you, and treat the substance use disorders. Then also you have a big opportunity to work in the jail and the prison. So the jail also you can use, like you can diagnose them, you can have what are the kind of a mental disorders they are having, and prison counselor you can work and treat the mental disorders and provide the cognitive behavioral therapy. Rehabilitation. What is rehabilitation is the medical, social, vocational measures train and retrain the individual to lead their normal life, help them to lead the normal life is called the rehabilitation. So there is a team of people will be working, and your job is very much important job, because where there is a mind is very strong, they can overcome. So rehabilitation, if you see, many people will be there, even a cardiac rehabilitation or amputated patient will be there, diabetic patients will be there. So prosthetists they will be using. And then sometimes I have seen some of the patients will be degenerative nerve disorder. The fourth semester he was studying, they told within eighth semester you will be totally blind. So you have to make them to accept denial, all these stages will be there, you have to understand, make them to accept. It is a big role, you have to play a big role. For that you have to need to have the 6 C's: care, compensation, like courage, good communication, commitment, and the non-judgmental behavior, and must be empathetic, and you should be a very much competent enough. So you will be social skill trainer, and you can work as a short-term psychotherapist. You can work on CBT, supportive treatments. You can give supportive counseling. You can give family counseling. You can give and particular case management. You can do play therapy, education, medication, administration. You will be doing. Next will be community mental health center. If the country or the community have the community kind of mental health center, in a which whatever the country it may be, the healthcare cost will be totally will reduced. So the great role the community health mental health nurse can play: risk assessment, who will be getting developed to get this mental disorder, and counselor, then aggression reduction, family counseling, home visit you can do, and the suicide prevention you can do, liaison between the other professionals. You can bring once in a while and conduct with the meeting with the home visits, and you can organize the meeting in a community centers. Then geriatric hospitals, so gerontology, right? Studying about the geriatrics, so you should learn about little about what is geriatric, what is their mindset, what is their psychology. They may mostly have the empty nest syndrome. All the children will be settled, they only made them to study, they only motivated them go to this country, abroad, this and all. After they have gone with abroad and everything, they feel empty nest syndrome. They feel nothing, I bought a child but nobody is with me in this old age, whether he will be doing the last ritual in my life, like that. So many thinkings will be coming in his mind. So how to maintain, for it will affect the mental disorder, will affect the quality of life. So it will be help them to maintain the quality of life, manage their chronic illness, because above 60 they may have some chronic illnesses. And you will do screening and rehabilitation services, and family counseling you have to give, like elderly abuse you have to reduce. You have to give a indirect way, that you have to give it to their family members, and collaborative with the other specialist you can give them. That's the advocate role, you have to collaborate with the other any medical treatment. So you may think that since the sugar level is high or the hormone level is there, that's why his behavior is there. Of course you have to consult with the doctors and change his tablets. Next is occupational health. This occupational health services also very important to detect the new health hazards in the occupation, what and all will be coming, and teach the risk, how to manage the risk management, life, how to identify the risk. One I have to learn, teach the life management skill, how to manage the work-life balance to overcome the stress and deal with the emotional problems, how to work-life balance. You first, just in occupational, if you follow the correct thing, ergonomics, fixing the right people to the right job. If the job they love, they will develop the passionate towards the job. If they develop the passion towards their job, it will not be burden for them. So there will be no stress. They love to do their job. That will give the new energy. Every day they will be coming resiliently, will be coming to the new job with a high motivation, they will come. So it is a psychologist who has to understand and fix them in the correct job to reduce the stress related behavioral problems, and family problems can be preventable if you are appointing psychologist in the occupational services. Track the work related mental illnesses and monitor the early signs of mental illness for the workers, and create the safe and healthy work environment. Administer medication if at all patients are there, you have to tell them that continuity of the medications and the referral services. If at all needed, you have to refer them for the services. And another important things, there are other scopes are also there. You can work in an Indian setup, also you can go to the abroad countries. Abroad you can go to the Middle East countries, or you can go to the Europe countries, Ireland, London, America, you can go everywhere. And AIMS Hospital, All India Institute of Medical Science Hospital, last of vacancies are the NIMHANS. NIMHANS is a National Institute of Medical Mental Health and the Neuroscience Hospital. This is a very big hospital, the central government sponsored health scheme hospital, which is there in the Bangalore. So you have a more opportunity to work there. And the ESA hospital throughout the India, central government, under the central government health scheme, you have opportunity to work as a counselor. And ICMR, you can participate in the research. And college and nursing schools, government and private nursing school, as a teacher you can work. And primary healthcare center you can work as a counselor, where there is a HIV AIDS diagnosed patients, the dots under that some so you need the chronic newly diagnosed diseases, either the TB or chronic illness or HIV AIDS or cancer. This one you have to see that. And then telecounselor, you can advertise yourself as a counselor, anybody need, and through the telephone you can do the counseling. And mobile clinic team, we have the mobile clinic services in the big corporate hospital. So in that, counselor also can go, and army and railway and military hospital. So these are all the places you can able to work. So this is the overall scope of community health, community mental health or psychiatric scope of psychiatry nursing or mental health nursing. So if you study mental health nursing, you have this many opportunities to work in a various places: schools, hospice, DADC center, forensic psychiatry nursing is very important. Nowadays the new emerging, you have a forensic nursing also is there. They are also having opportunity to work there. Mainly you have to take the records, the evidence only speak more about it. Sometimes you have to screen for HIV, and you have to specimen collection, and then genital examination you have to do. And you have to understand what is their psychology of the criminals, because you will be always dealing with the criminals. So you have to do criminal psychology, especially you have to read about the psychology of the criminals. So occupational hospice school. So overall, that your behavior should be, above all, you be non-judgmental and be empathetic towards the patients. Okay, so always be care, compassion, courage, commitment, good communication and competence. So this is the scope of mental health nursing or scope of psychiatry nursing. Thank you.